Good morning, everyone, and thank you for joining me today. We're going to explore a very important and timely topic: mood disorders in youth. Our focus will be on understanding the complexities, the impact these disorders have, and the various treatment options available. Specifically, we'll be taking a comprehensive look at depressive and bipolar disorders among children and adolescents. This presentation aims to shed light on the challenges faced by young individuals, as well as the ways we can support their mental health effectively. Let's dive in and learn more about this critical area. When we talk about mood disorders, we're referring to conditions where emotions like sadness, happiness, anger, or irritability become extreme, last for a long time, or feel out of control. These intense emotions cause significant distress and can really interfere with a young person's daily life. Mood disorders are actually among the most common and persistent mental health challenges faced by children and adolescents, often leading to chronic issues that can be disabling. To put it in perspective, over 3 million young people in the US experience significant depression each year, and experts predict that by 2030, depression will be the leading cause of disability worldwide. This really underscores how important it is to understand and address these conditions early. As Charlie Brown once said, "If you're going to get any joy out of being depressed, you've got to stand like this." It's a poignant reminder of just how complex and impactful mood disorders can be during youth. Mood disorders encompass a wide range of conditions, with symptoms that can vary significantly in severity and nature. On one end of the spectrum, we have severe depression, which primarily involves persistent feelings of sadness, hopelessness, and a loss of interest in everyday activities. On the other end, there's bipolar disorder, often referred to as BP, which is marked by dramatic shifts in mood, including periods of intense highs or mania, as well as episodes of deep depression. Understanding that these disorders exist along a continuum helps us recognize the diverse experiences of those affected and the importance of tailored treatment approaches. When we talk about depressive disorders in youth, there are three main types to keep in mind. First, major depressive disorder, or MDD, which involves intense mood disruption lasting at least 2 weeks. Then there's persistent depressive disorder, or PDD, which tends to be milder but is long-lasting, persisting for a year or more. Lastly, disruptive mood dysregulation disorder, or DMDD, is characterized by chronic severe irritability and frequent temper outbursts. Focusing on MDD, the key feature is that intense mood disruption, which really affects the child's emotions over a relatively short but significant period. For PDD, the depression is less severe but sticks around much longer, making it a chronic condition. With DMDD, the hallmark symptoms are persistent irritability and frequent, severe temper tantrums that are out of proportion to the situation. All of these disorders significantly impact a child's daily life. They can disrupt how children function day to day, affecting their relationships, school performance, and overall well-being. It's also important to note that children often express depression differently from adults, with irritability often being a key symptom instead of just sadness. Understanding these characteristics helps us better identify and support young people struggling with depression. When diagnosing major depressive disorder, there are several key criteria we need to consider. First, Criterion A requires that a person experiences at least 5 symptoms, including a depressed or irritable mood and a noticeable loss of interest or pleasure, lasting for at least 2 weeks. This duration and the presence of multiple symptoms help us identify a significant depressive episode. Next, Criterion B emphasizes that these symptoms must cause significant distress or impair the person's ability to function in daily life, whether at work, school, or in social situations. It's not just feeling sad, it's about the impact on overall well-being. Criterion C is important because it rules out symptoms caused by substances, like drugs or medication, or other medical conditions, ensuring the depression is not secondary to another cause. Criterion D ensures that the symptoms aren't better explained by psychotic disorders, which have their own diagnostic criteria. Finally, Criterion E excludes anyone with a history of manic or hypomanic episodes, which would suggest a different diagnosis, such as bipolar disorder. Together, these criteria help us make an accurate diagnosis and tailor treatment effectively. Here we see the prevalence of major depressive disorder across different age groups, separated by gender. Notice that in early childhood, ages 6 to 11, The rates of depression are about the same for girls and boys, both at 3%. However, starting around age 12 to 14, the rate among girls doubles compared to boys, with 10% of girls experiencing depression versus 5% of boys. This gap widens even more in the 15 to 18 age group, where 20% of girls report depression, compared to only 7% of boys. These trends highlight a significant gender difference in depression rates that becomes more pronounced during adolescence. Understanding this pattern is crucial for targeting interventions and support during these key developmental years. When we look at major depressive disorder in young people, one of the most striking findings is how common it is for them to have additional disorders alongside depression. In fact, up to 90% of youths diagnosed with MDD also have at least one other disorder. Even more concerning is that nearly half of these young individuals experience two or more coexisting disorders. This high rate of comorbidity highlights the complexity of treating depression in youths and the importance of a comprehensive approach to their mental health care. Persistent depressive disorder, or PDD, is defined primarily by a mood that is depressed or irritable most days, lasting for at least a full year in children. Unlike major depressive disorder, the symptoms in PDD tend to be less severe, but they persist over a much longer period. This chronic nature means that rather than experiencing intense episodes, individuals often deal with a consistent, lower level of distress. The symptoms can include physical complaints like trouble sleeping, as well as cognitive issues such as feelings of low self-worth. This combination of ongoing mood changes and milder yet enduring symptoms makes PDD a unique and important condition to understand. Disruptive mood dysregulation disorder, or DMDD, is a relatively new diagnosis in the realm of depressive disorders. It's characterized by severe and frequent temper outbursts that seem disproportionate to whatever is happening at the moment. These outbursts go beyond what you'd expect in typical mood swings and can significantly impact a person's daily life and relationships. Understanding this helps us recognize the seriousness of the disorder and the importance of proper diagnosis and treatment. When we look at depressive disorders in youth, there are several key characteristics to keep in mind. First, many young people with depression experience cognitive biases. They tend to have negative automatic thoughts and hold pessimistic views about themselves, the world around them, and their future. This is often called the negative cognitive triad. They also engage in a depressive ruminative style, which means they focus repetitively on negative events, making it harder to break free from those feelings. Social difficulties are another major factor. Depressed youth often withdraw from others, feel lonely, and have poor peer relationships. In some cases, co-rumination, where they and their friends excessively discuss problems, can actually increase the risk of depression, especially among girls. Family relationships tend to play a big role as well. These young people often come from environments with more conflict and less emotional warmth or support, which can exacerbate depressive symptoms. Importantly, depression in youth is strongly linked to suicidal thoughts and behaviors. Approximately 30% of young people who think about suicide end up making an attempt, highlighting the critical need for early intervention and support. Understanding these characteristics helps us better support depressed youth and address these complex challenges. When we look at the theories of depression, each one offers a unique perspective on what might contribute to the condition. The psychodynamic theory suggests that depression can stem from the loss of a loved object, where the resulting anger is turned inward. Attachment theory focuses on how insecure attachments can lead to negative views of oneself and others, affecting emotional health. Behavioral theory highlights how a lack of positive reinforcement and skill deficits can play a role. Cognitive theory emphasizes the impact of negative thinking patterns and distorted beliefs that fuel depressive feelings. Interpersonal theory points out how disrupted relationships can influence mood and contribute to depression. The socio-environmental perspective considers the effects of stress and the availability or lack of social support. Lastly, the neurobiological theory looks at brain function and genetic factors that may predispose someone to depression. Understanding these theories helps us grasp the complexity of depression and guides how we approach treatment. When we look at the causes of depression, it's important to understand that multiple factors come together, creating a complex picture. First, genetic vulnerability plays a role by shaping our temperament and how our brain systems function, making some individuals more susceptible. Then, neurobiological factors come into play, including abnormalities in brain structure or function, as well as dysregulation in the HPA axis, which governs our stress response. The family environment is also crucial. Things like the quality of parenting, the security of attachments formed in childhood, and the presence of family stress or conflict can all contribute. On top of that, cognitive patterns, such as holding negative beliefs about oneself and relying on maladaptive coping strategies, reinforce the risk. Finally, life stressors, whether severe events or everyday hassles, add to the pressure. These elements often interact throughout a person's development, with negative experiences intensifying cognitive and emotional vulnerabilities, which together can lead to depression. Understanding this integrative framework helps us see why treatment often needs to address multiple areas. When it comes to treating depression in young people, psychosocial therapies play a central role. One of the most effective approaches is cognitive behavioral therapy, or CBT. This method helps youth develop practical skills, rethink negative thought patterns, and engage in activities that boost their mood and motivation. Another important therapy is interpersonal psychotherapy for adolescents, known as IPTA, which focuses on improving communication skills and strengthening relationships. Both therapies aim to provide young individuals with tools to manage their depression and build healthier connections in their lives. Bipolar disorder in young people is characterized by distinct mood cycles. These cycles can swing from manic episodes, where mood is unusually elevated or irritable and energy levels are high, to depressive episodes, which are marked by feelings of sadness and low energy. Mania itself presents with several noticeable symptoms. Young individuals may show inflated self-esteem or grandiosity, need less sleep than usual, speak rapidly or feel pressured to talk, become easily distracted, and sometimes engage in reckless or risky behavior. Diagnosing bipolar disorder in children can be particularly tricky. This is because many symptoms overlap with other conditions like ADHD, and the way bipolar disorder shows up can vary widely. As for how common it is, bipolar disorder is less frequent than major depressive disorder in youth. It affects somewhere between 0.5% and 2.5% of young people over their lifetime, typically beginning in adolescence. Understanding these key points helps us better recognize and support youth living with bipolar disorder. When we talk about bipolar disorder, one of the key features to understand is the manic episode. A manic episode is defined by a period of at least 1 week where a person experiences an abnormally elevated or irritable mood, along with increased energy and goal-directed activity. During this time, you might notice symptoms such as grandiosity, where the person feels extremely confident or even invincible. They may also need much less sleep than usual, yet still not feel tired. Their thoughts can race, and their speech becomes rapid. Additionally, distractibility is common, making it hard for them to focus. Risky behaviors often occur as well, which can impact their personal or professional life. Now, hypomanic episodes are similar in nature but less intense and shorter in duration. They don't cause the severe impairment seen in manic episodes, but still indicate a noticeable change in mood and activity levels. So, the main symptoms to watch for during a manic episode include grandiosity, reduced need for sleep, racing thoughts paired with rapid speech, distractibility, and engaging in risky behaviors. Recognizing these signs is crucial for diagnosis and effective treatment planning. Bipolar disorder is influenced by both genetic and environmental factors. It's highly heritable, meaning there's a strong genetic component that makes some people more vulnerable. But it's not just genetics. Environmental stressors and family dynamics also play a crucial role in triggering the disorder. When we look at brain imaging studies, we find abnormalities specifically in regions that regulate emotions, such as the amygdala and the anterior cingulate cortex. These brain areas are key in managing mood, which helps explain some of the emotional instability seen in bipolar disorder. Understanding these factors gives us a clearer picture of how the disorder develops and persists. When it comes to treating bipolar disorder, it's essential to use a multimodal treatment plan. This means that no single approach is enough on its own. Instead, effective treatment combines different methods to address the various aspects of the disorder. This could include medication to help stabilize mood, psychotherapy to provide coping strategies and support, lifestyle changes to promote overall well-being, and sometimes other interventions tailored to the individual's needs. The goal is to create a comprehensive plan that manages symptoms, reduces episodes, and improves quality of life in a balanced way.